Trump keeps talking. Some Republicans don't like what they're hearing. Aides and allies increasingly believe the president's daily briefings are hurting him more than helping, and are urging him to let his medical experts take center stage. In his daily briefings on the coronavirus, President Trump has brandished all the familiar tools in his rhetorical arsenal, belittling Democratic governors, demonizing the media, trading in innuendo and bulldozing over the guidance of experts. With only intermittent attempts to adapt to a moment of crisis, Mr. Trump is effectively wagering that he can win re-election in the midst of a national emergency on a platform of polarization. Yet the publicity-obsessed president is unlikely to relinquish his grip on the evening sessions. Mr. Trump has told aides he relishes the free television time and boffo ratings that come with his appearances, administration officials say. On a day that New York State reported 799 deaths from the coronavirus in a 24-hour period, Mr. Trump's focus was on himself and his feuds. There is some preliminary evidence that Mr. Trump is heeding the Republicans' concerns. On Wednesday and Thursday, Mr. Trump made what were for him relatively brief appearances before leaving the room and turning the podium over to Mr. Pence and doctors. And it's not just an overwhelming majority of voters who believe the medical experts should be center stage. Senator Mitch McConnell, the majority leader, personally urged Mr. Trump at the start of the crisis to let doctors. During these difficult times, Americans are receiving comfort, hope and resources from their president, as well as their local officials, and Americans are responding in unprecedented ways. Some of Mr. Trump's aides have quietly suggested to him that he ratchet back his public attacks on the governors who have emerged as leaders in the response to the virus. Gretchen Whitmer of Michigan, a popular Democrat and potential vice presidential pick for Mr. Biden, whom Mr. Trump called a half-wit and that woman, were of particular concern to some aides and political advisers, who believe he risked alienating voters in a pivotal state. At Mr. Trump's re-election campaign, staff members have closely monitored internal polling data showing an erosion of the gains Mr. Trump made immediately after he put social distancing guidelines in place. Advisors are torn between knowing that a less abrasive approach would help Mr. Trump and their awareness that he can't tolerate criticism, regardless of the setting. Mr. Trump's limited gains in the polls are all the more striking when compared with those made by governors in both parties. Many are enjoying double-digit gains in their approval ratings. And Mr. Trump's penchant for ad hominem attacks, Republicans say, illustrates why he has little room for growth among the electorate. That would prove difficult for even a more conventional president at a time the country is so politically divided, but a number of prominent Republicans believe Mr. Trump has hurt himself by making only the most halting attempts at demonstrating an above-the-fray unity. Bill Haslam of Tennessee, recalling how Mr. Obama deployed Mr. Bush and former President Bill Clinton to lead the United States assistance to Haiti after the devastating 2010 earthquake there. But Mr. Haslam and other Republicans believe Mr. Trump needs to go much further. And then there's the matter of Mr. Trump and his conduct at the daily briefings. Mr. Toomey has been outspoken about the need for Americans to wear masks when they leave home. By week's end, the Centers for Disease Control and Prevention had issued guidelines: people should wear cloth face coverings in public settings where other social distancing measures are difficult to maintain. The agency decision was based in part on recent studies showing that people without symptoms can give the virus to others. Recommends that you call your healthcare provider and explain your symptoms and fears. If the family member doesn't need hospitalization and can be cared for at home, you should help him or her with basic needs and monitor the symptoms, while also keeping as much distance as possible, according to guidelines issued by the CDC. If there's space, the sick family member should stay in a separate room and use a separate bathroom. Yes, but make sure you keep 6 feet of distance between you and people who don't live in your home.